Rhinoplasty has a prolonged healing process. You may think it looks pretty good at a month, but it's going to be a lot better at 3 months. And you're going to think at a year that you were done at 3 months, but you weren't even close in retrospect. There's variability in healing. Swelling, skin thickness, scar tissue from previous surgery, all of those can affect the result as well as the healing time in the process. Minor imperfections may require in-office, small procedures, touch-ups, etc. But even in the best hand, there are occasional needs for revision. So follow-up in our office is done 6 days after surgery for cast, suture, and splint removal, typically a month after that, typically 6 to 8 weeks after that, and then every 3 months until we get to the 1-year post-op mark. At that point, it's individualized with most patients not needing any further follow-up, but if they are thicker skinned, multiple revision patients, sometimes we'll see them for years to come as there are subtle changes continuing to occur. For our out-of-town patients, initially we can sometimes see them as a virtual consultation. We obviously need to see them in person prior to surgery, but that could even be the day before if necessary. They are in town for a week. We see them back typically at that 6-day mark where we get the cast, the sutures, and the splints out. They're then able to fly home. We'll usually do a 1-month telemedicine visit, follow-up thereafter. And then their next visit, which is typically 6 to 8 weeks after that one, we'd like to see them in person. And then we play it by ear somewhat. Typically, we'll see those patients every 3 months until we get to the 1-year mark. Depending on how they're progressing, sometimes we can alternate virtual visits with in-person visits. You should feel comfortable understanding the follow-up schedule and what that is going to entail, both from the nurses that are going to contact you potentially right after surgery, to the pre-op visits, to the need for in-person visits and what frequency thereafter. Your relationship with your rhinoplasty surgeon does not end when your cast comes off.